Governments around the world have put either part or all of their population under strict lockdown measures in an attempt to stop the rapid spread of COVID-19. The goal is to reduce the number of daily cases to ensure it remains below the coping capacity of healthcare systems. This has been referred to as flattening the curve. But the concern is that if lockdown measures are eased, then a second peak and even later peaks could cripple healthcare systems into the near future. One strategy to maintain a reduction in daily cases without using mass lockdown measures is known as contact tracing. This involves identifying, tracking and isolating individual cases of COVID-19 to suppress it from spreading throughout a population. It's usually a very labour-intensive process, but now big data and technology are allowing for new solutions. The first country to lift local lockdown measures and trial one of these new technology-led contact tracing solutions is China. Here, local governments are pairing with major tech companies such as Alipay and Tencent to create what they're calling a traffic light system. Data points around a user's activities, personal connections, and travel history provide a coloured health QR code. Red means you should be under supervised quarantine. Yellow indicates that you should self-quarantine for 14 days, and green means that you can travel freely. Your status is regularly checked whilst travelling throughout the country. If you come into contact with the virus, then your status will change and you will no longer be able to travel, forcing you to isolate. A similar contact tracing approach has been very successful in South Korea. After a different coronavirus outbreak called MERS hit the country in 2015, emergency legislation was created which allowed health officials to trace the footsteps of citizens who test positive for an infectious disease using CCTV, credit card records, and GPS data. When they received their first positive COVID-19 patient in January 2020, this legislation was brought to the fore again and used to identify everyone that had been in prolonged contact with the infected individual. They were all tested and then quarantined if necessary. The government also released anonymised smartphone alerts to inform the wider population of the infected person's previous movements. If tested positive, an infectious person can choose to self-isolate at home, but is required to download an app, which alerts an assigned health official if they leave their home during the quarantine period. This process has helped South Korea avoid national lockdown, but has raised privacy concerns that have forced other governments and institutions to look at alternative methods. Another country which has also avoided national lockdown by using widespread testing and very intensive traditional manual contact tracing is Singapore. To support these measures, the Ministry of Health released the app Trace Together. It's voluntary for people to download and has a strong focus on digital privacy measures, such as avoiding using location data. Instead, it works by using Bluetooth to identify other mobile phones within a 2 to 5 metre radius. As an individual goes about their day, the app logs the anonymised data for those who have been in close proximity. These are then stored in an encrypted log on the phone. If the individual wakes up the next day with a fever, this can be reported on the app, and then the Ministry of Health can request their log data, decrypt the information, de-anonymise it to reveal the phone numbers of those who have been in close contact, and then use to inform them to self-isolate. Using technology this way allows for a scalable contact tracing solution that is accurate, efficient, and instantaneous. For these reasons, many other governments and institutions such as the NHS in the UK and MIT Media Lab in the US are developing applications using similar Bluetooth-based approaches. One caveat, according to the researchers at the University of Oxford, is that effective digital herd protection, as it's known, requires 60% of the population to voluntarily download and use the app. That's a big ask. Contact tracing does have one major weakness: asymptomatic spreaders. These are individuals that carry the disease, pass it on to others, but don't have symptoms themselves and don't isolate. But how many asymptomatic carriers of COVID-19 are there? Well, it's difficult to calculate. One study focuses on the Diamond Princess cruise ship, which was hit by coronavirus and quarantined in Japanese waters on the 3rd of February, with 3,711 passengers and crew. 634 individuals ended up testing positive for COVID-19. 52% showed no symptoms at the time. Approximately 30% of those went on to show symptoms later, leaving 18% testing positive but never showing any signs of illness. Other studies in Japan and China suggest the figure could be as high as 30%. For these reasons, contact tracing must work alongside rigorous widespread testing and other social distancing measures to ensure lives are not put in any unnecessary risk when countries emerge from lockdown.